Hello. Um, I find the perception of cancer to be unlike the reality of living with cancer. There's the cinematic perception of it. It tends to paint uh, the life of a cancer patient as something tragic, of course, and very nearly heroic. Oh, you're so strong. You're so brave. You're the heroic battle with. We're just living lives. I mean, the reality of it is we're just living our lives. And in that life, what cancer does, aside from bring with it the host of medical realities and tactical changes and logistics, um, sartorial changes, one basically uh, lives a life with a more pronounced awareness of fatality. It's basically it. We are all, as organic beings, going to die. With a cancer diagnosis, it's just that the reality of that death is lit in neon, little blinking neon lights, little penguin with a sandwich board wandering around saying, cancer, cancer, death is imminent, death is certain. But it may not be imminent. It could take years. There are people who live decades with a cancer diagnosis or after a cancer diagnosis. I was diagnosed in August of 2015. I feel well. I feel great. I really do. Because the reality is the cancer itself, what does cancer feel like? It feels like nothing. It feels like air that's not, it's still air, light, space, pixie dust. Although pixie dust is a little more cute and benign than a cancer cell. But cancer cells are the biological ninja. They settle into a body for whatever buffet of triggers, factors, influences, genetic, environmental, chemical, life choices, body type, whatever happened to cause that abnormality. There was an abnormal cell that grew and developed, and it was cancer, and all it wants to do is replicate. All it wants to do is invade and take over. Cede to us your land, we shall occupy it. And it does. And people very often live with cancer completely unaware it's there because it doesn't hurt. It doesn't say much. It's not loud at all until or unless some other body's system or function is compromised. A person feels a lump or has abnormal bleeding or has abnormal swelling or has abnormal pain, which isn't the cancer. It's an organ that's diseased, or it's a, a uterus that's become infected with cancer and swollen, or yeah, there's gross cysts. I mean, it's for my own cancer diagnosis. I backed into it. I went to a gastroenterologist having what I thought was just an insane bloat. We gastroparesis patients are distended every day. When we eat, we bloat, we blow up. And I just thought that summer I had tremendous bloat. And my primary agreed, and she put me on a probiotic, and it didn't really help. Go figure. Here, eat this fruit, it'll cure cancer. Well, probiotics do not. So I went to the gastroenterologist and saw one of his assistants, and she said, well, I don't know about this bloat, but I feel a large hard mass up in your upper abdomen, and that's not normal in, I don't know, 27 years of feeling abdomens. She's never felt that. So off I went to ER at one hospital in Grand Rapids to get a CT, emergency CT, and the gentleman came in and said, well, uh, that large hard mass she felt is fine. It's your liver. It looks perfectly normal. It was just floating near the surface of your skin in fluid. Your abdomen is filled with fluid called ascites. That's when fluid fills a body cavity. It's called ascites. And however, you do have several masses in your ovaries and your omentum. Okay, then. Off I was transferred to the other hospital and admitted, and the tests run, and the gynecological oncologist who became my doctor, she's fabulous, came in to see me the next morning and said, given your tests and your symptoms, I am 99.9% sure, just like Ivory soap is pure, that you have ovarian cancer. It was August 18th, 2015, and I thought I just had bloat. That I had surgery chemo, and was cleared the following year, and I was active, I felt good, and then I developed a cough in August, I think, of 2016. It didn't go away, and I somehow didn't realize I was having an asthma flare. I have asthma. It was just this cough, and because I had cancer, I thought, well, let's go get it checked, because once one has cancer diagnosis, everything is suspicious. What's this spot? Is it cancer? So I went in, and the guy did an x-ray and said, no, I don't see anything. I don't see anything potentially dangerous, but given your history, you know, I suggest you have a CT, and everybody agreed. So I had a CT of my lungs, and they said, well, no, your lungs look great. There are some, because he thought, the radiologist saw bony masses in my spine on that x-ray, so I had the CT. And they said, no, the bony masses aren't bony masses, it's just calcifications, bone spurs on your spine, basically. However, and your lungs look great. However, you have enlarged lymph nodes in your upper abdomen, near your liver, and up near your heart. So I had another abdominal CT, and it shows several lymph nodes enlarged, and that were cancerous. So I went into a clinical trial for a year, which was fascinating. And then this year, I went back into infusion chemo because the clinical study drug, while it was hell on cancer, it was hell on me. And the side effects were so toxic, I had to keep going down in dose until it just wasn't effective anymore. So now I'm just finishing up with the infusion chemotherapy. And again, still, as how it's been these last 3 years, I don't feel any cancer. I don't have a perception of it in my body. I have verification on film that it's there. But I don't have a feeling of it in my body. I have a lot of other illnesses and conditions and a lot of chronic daily pain from other things. So I hurt, but not from the cancer. I'm compromised and limited, but not from the cancer. I do tend to get tired. And right after chemo, I'm not feeling good for a few days. But right now, I feel well. I have energy. I feel good. I'm looking forward with positivity, and as many years as I get, it will be a blessing. So, what does cancer feel like? Nothing. You won't know it's there. Just get your annual tests, do your screenings, be aware of anything abnormal, any change you can't explain, anything new, any symptom that doesn't feel right. Just get it checked out. It can be scary to do that, but if the cancer is in there, you want to know. Oh, that was presumptuous. Some people might not want to know. They just might want to just go through life and die early. I don't choose to. I want to have as much life as I can. Have a great day. Take care.